Good afternoon, everyone. Welcome to the Global Indoor Air Quality and Respiratory Infection webinar series. My name is Professor Prashant Kumar, and we have two of our speakers coming from Egypt and Kurdistan region in Iraq. So they will be talking about about the indoor air quality in their region. Just to start with, there are a few kind of housekeeping notes. The first thing is that if you have any questions on the talks, which you're gonna hear in a few minutes time, so please use the Q&A, the button you can see on your screen, and put your questions there. We will be picking up the questions towards the end of both the talks. This video is being recorded and it will be put on the YouTube channel. So we will send you the link. I will post you the link in the chat box at some point, so you can watch it later on. Can share with the colleagues in case if there is an interest there. And last but not the least, we have a weather warning in the UK today. So if something goes wrong in between, so that's not intentional. But hopefully the session will run smoothly. One of the just to give a very quick kind of a background about this project. So this is called Knowledge Transfer and Practical Application of Research on Indoor Air Quality, which we call it KTP-IAQ. So this is a knowledge exchange platform across the ODA countries with the aim to share and discuss the state of the art best practices on indoor air quality and respiratory infection. This is the I think it's the 6th webinar today that has been covering this topic. We have 12 ODA countries involved in it, which represents 13 cities. Each city has got a the PI with almost over 40 the researchers at the master's, PhD, and the postdoctoral researcher level. So it's a very interesting kind of a network, and that is kind of follows the franchisee of the clean air engineering the projects we had in the past. So for example, we started with the clean air engineering for cities project, so where we call it Care City. So you can see the map there. So we had these regions involved from the Latin America, then from Southeast Asia, Africa, and the Middle East. So these are the number of cities which we have been kind of focusing in, and then later on we had another edition for the country on Nigeria. So we have been focusing on the city there called Akure. From the clean air engineering of cities, we had a focus across the car exposure. So you could see a number of these publications being produced, where we try to look into what is the level of exposure in different cities, especially when people are commuting by cars, and then what kind of potential health risks and the economic kind of the consequences they bear. So you can see more about these projects there. And then we had the next project in this franchisee, which is called the Clean Air Engineering for Homes, which is called Care Homes. So there we focused on the in-kitchen aerosol exposure. So this is the work which is currently under review. So where we had all these 12 cities involved, and we tried to kind of look into the exposure conditions, the ventilation conditions, and so on within those cities. The next, so this is the second last webinar, and the next one will be on 25th of March, where we have a colleague from Trinity College Dublin who will be talking about the passive indoor air quality, and I will be providing an overview of the work we have been doing as part of this the CARE kind of franchisee over the last the few years. So it is my pleasure today to invite Professor Susan Lanham-New, who is a dear colleague at the University of Surrey, to open this webinar. She's a professor of human nutrition and head of the department at the University of Surrey. She led a successful nutritional science at Surrey application for the 2017 Queen's Anniversary Prize. And Surrey is the first university to ever be awarded this prestigious prize for the subject of flood and nutrition for health. Susan is a member of the Government Scientific Advisory Committee on Nutrition, which is responsible for setting up the UK's nutrition requirements. And she's also the editor-in-chief of the Nutrition Society, the textbook series. So there are a number of the achievements in her, to her credit. She has recently been given the fellowship status of the Royal Society of Biology and the Association for Nutrition, and is the honorary secretary of a NUTSOC. Susan led a number of publications linking with the vitamin D and the COVID-19, which has been groundbreaking in that particular area. And she's been involved very actively in promoting the role of the vitamin D during the COVID-19 the pandemic. So I can keep talking about her achievements, but I will stop here and I will pass it on to Susan to open the webinar and introduce our the first speaker.
Well, thank you very much, Prashant, for such a kind introduction. And it's a great, great pleasure for me to introduce the two speakers for this incredibly fascinating webinar. And congratulations to you and your colleagues for your success in such an important area. And so the way that we will run this is, of course, two speakers. So it is a great honor for me to invite our first speaker, Dr. Ahmed El-Gandy, who is currently an associate professor in the Department of Construction Engineering at the American University in Cairo, Egypt. So very, very welcome to you. He is indeed a Fulbright alumnus, which is a fantastic achievement. And he has a very important area of research that he does, which specifically includes water purification and wastewater treatment technologies, sludge management and treatment, phytotechnology, the remediation of contaminated sites, and of course, hazardous waste treatment and air pollution control. And so we look forward very much indeed, Professor Ahmed, to your presentation. And as your chair, I will keep you to time. So you have 20 minutes to present, followed by another 20-minute presentation for our second speaker, and then back to Prashant to chair the questions for 10 minutes. So please, Professor Ahmed, over to you.
Thank you, Professor Susan, for your introduction. And thanks to Professor Prashant for inviting me to this series of seminars. My presentation today is on indoor air quality in kitchens of low-income homes in Cairo. The contents of my presentation will go through indoor air pollution, the problems associated with poor indoor air quality. I'm going to talk about the care homes, which is in Cairo, which is part of the care home project. Then I'm going to explain some of the findings of the study in Cairo. The WHO has depicted that each year, close to 4 million people die prematurely from illness attributed to household air pollution, from inefficient cooking practices, using polluting stove paired with solid fuels and kerosene. They are also indicated that household air pollution causes non-communicable diseases, including stroke, asthmatic heart disease, chronic obstructive pulmonary disease, and lung cancer. Close to half of deaths due to pneumonia among children under 5 years of age are caused by particulate matter inhaled from household air pollution. So this rings a big alarm for indoor air quality in homes of low-income countries. So if we need to identify the sources, the possible sources of indoor air quality or indoor air pollution, this includes many sources such as smoking, cooking, and mold due to dampness. It can be also due to home renovation, house cleaning, or heating, and some household items and furniture. These sources can contribute to many emissions, such as formaldehyde, particulate matters, carbon dioxide, carbon monoxide, VOCs, and nitrogen dioxide, asbestos, and biological pollutants. These pollutants can cause many effects on human health. These effects may range from respiratory and asthmatic symptoms to irritation in the nose, eye, coughing, chest pain, headache, breathing problems, and cancer. So this actually will lead us to the importance of improving indoor air quality, which actually aligns with the United Nations Sustainable Development Goals about improving the health and well-being of human, which is goal number 3, to achieve sustainable cities and communities, which is goal number 11. In a project by Harvard University, there have been 9 foundations identified of healthy buildings. Among these 9 foundations, 5 of them are related to indoor air environment or environmental quality. This includes ventilation, air quality, thermal health, moisture, and dust and pests. Since cooking is one of the most polluting indoor activities carried out by urban inhabitants in low-income homes, and when it is combined with suboptimal ventilation conditions, so cooking can pose high risk to human health. Such issues are more prevalent in low-income homes in populous cities such as Cairo, for example, in developing countries, where indoor air pollution and its negative health effects are widespread. More studies as a result and efforts are needed in such locations to quantify the extent of impact of cooking on indoor air quality. It's also to understand factors affecting indoor air quality in such indoor microenvironments such as kitchens. It's also to propose possible control measures for homeowners and home designers. Unfortunately, in Egypt, we have very limited studies and data on indoor air quality monitoring. And there is no such standards for indoor air quality in the Egyptian homes. However, we have some standards for ambient air. Therefore, we have this initiative, which is Care Home Project in Cairo, where the main objective is to assess indoor air quality in kitchens of low-income homes across Greater Cairo. This project or this study is part of the big Care Home Project, which is managed by Global Center for Clean Air Research at the University of Surrey, which aims to study and do indoor air quality measurements in 12 global cities for establishing tentative house exposure profiles and providing viable indoor air quality improvement strategies that would be applicable and beneficial to all communities. I'll start by defining our study area. Our study area is the city of Cairo. Cairo is the capital of Egypt. Egypt is part of the Middle East and is located at the northern part of the continent of Africa. Cairo is actually having an area of 3,085 square kilometers. It's a huge city, huge metropolitan area, with a population that can reach up to 20 million capita. Cairo has many areas that are densely populated, and we have selected 5 homes within these densely populated areas, such as Rud al-Farag, Shobra, and El Zaytun. The selected 5 homes, we have photos of them as you see in the slide. And these homes are about 30 to 50 meters away from heavy traffic roads. The homes are actually 2-bedroom apartments with approximately 4 occupants. They are located in 5 to 10-story buildings that are made of brick and cement. Typically, the ground floors in these buildings are used for commercial services. No heating or cooling systems are used in these kitchens. And the stove or cookers are a standalone unit that is composed of 4 to 5 burner gas hobs and an oven. The cooking habits in these kitchens kitchens were used 2 to 4 times every day for different activities of cooking, such as frying, grilling, boiling, oven baking, and reheating of food. Each event of cooking or each cooking session lasted for 30 to 50 minutes. Since Egypt is one of the natural gas producer in the region, so the fuel type that is used in Egyptian homes is natural gas, and this is the same type of fuel that is used in these selected 5 homes in the study. All kitchens in the 5 homes were separate kitchens where they are not open to the apartment, so they have a door to a separate room. The daily average cooking time ranges between 85 minutes per day to 190 minutes per day. During the cooking time, there are usually 1 to 2 occupants in each kitchen. The ventilation type that is used in these 5 homes are ranging between dual ventilation. Dual here, I mean with it natural and mechanical, using extraction fan, and natural using window and door open of the kitchen. And the other ventilations that was used in some of the homes include natural ventilation with door open only, or natural ventilation only with door and window open. We have decided to select few parameters to measure to assess the indoor air quality of these 5 homes. One of the parameters is particulate matters. We have selected particulate matters because they are emitted during cooking and have been identified as a major indoor air pollution. Also, the exposure to high levels of particulate matters has been linked to numerous adverse health impacts, such as pneumonia, heart diseases, stroke, lung cancer, and chronic obstructive pulmonary disease. We have also decided to measure CO2 as one of the parameters to assess the indoor air quality, because it's actually can be used as an indicator of the ventilation. It's also can cause some pollution that has been associated with sick building syndromes, which lead to various symptoms such as headache, fatigue, drowsiness, nose and throat ailments, nausea, and poor concentration among people who inhale this CO2 at high concentration. So we have decided to select CO2 as another parameter to monitor in this study. In addition to that, we have decided to also monitor the temperature and relative humidity which can define the comfort or the heat comfort in these kitchens. All of these parameters were monitored continuously using these devices in photo in front of you. These devices were monitoring these parameters every minute and recorded, and the data were collected every day. This graph shows actually the particulate matter concentration as PM2.5 and PM10 for the different homes in the study in Cairo. Based on the results that we have, we can see that we can see several peaks here. These peaks indicate the cooking events in each of these homes. Also, based on this result, it was found that the average ratio of PM2.5 and PM10 is below 0.5, which indicate that the dominant contribution of coarse particles are those from food boiling or fugitive dust resuspension in the kitchens of the studied homes. It was also found that the health risk that were estimated in reference to WHO recommendation for PM2.5, which is 15 microgram per meter cube, exceeded 1 in all of the homes, which actually require that we should minimize the number of occupants in these kitchens during the cooking events to reduce the risk of these particulate matters on the human health in these homes. Okay, so the next slide actually shows the indoor air quality in terms of the CO2 concentration, in terms also of the temperature and relative humidity for the 5 homes in the study of Cairo. It was noticed that the mean value of CO2 is actually in all homes is in the safe range. It's below 1,000 parts per million. However, like during cooking times, these values might exceed a little bit the 1,000 limit for safe CO2 value. The hazard ratio value were estimated for 2.5 hour exposure of CO2 concentration average of 1,000 parts per million. And it was found that all homes in Cairo area in the study in our study were less than 1, which indicate that the hazard ratio indicate that it's safe to use in terms of CO2 effect. Also, it was found that the air exchange rate was measured throughout different homes and were assessed according to the type of ventilation that was used in these homes. And it was used to calculate the ventilation rate in each home. And it was found that the dual ventilation has good to excellent ventilation rate. And it was better than natural ventilation with door and window open, and more better than natural ventilation with a door open. At the end, I would like to acknowledge the contribution of Dr. Rana Mustafa. She's an adjunct faculty at the American University in Cairo, and she was part of the Care Home Egypt Cairo team. Thank you very much.
Thank you very much indeed, Professor Ahmed. That was a wonderful talk, and you've kept the time for us so beautifully. So we're going to hold any questions and we will come back to those. And so with no further ado and completely on time, so thank you again for that. I'm very pleased to invite forward our second speaker, Professor Khalid Omer. Now, Professor Omer is Professor of Environmental and Analytical Chemistry in the Department of Chemistry at the University of Sulaimani in Kurdistan. He did his BSc and MSc in Chemistry in the Salahuddin University, Urban in Kurdistan, and his PhD at the University of Texas in the USA. And he is leading on nanotechnology and environmental aspects. And so please, Professor Khalid, we look forward very much indeed to what you have to say, together with your colleague, Dr. Kosar Aziz, who I know is not able to join us, but is nonetheless part of your very important team. So please, Professor Khalid, over to you for your next 20 minutes.
Sure. Thank you very much, Susan. Thanks for all of you today, and I'm very glad to be among such a wonderful research team. And today I'll be talking about the work that we have been done in this group and in our city. The title of our talk is Indoor Aerosol Exposure in Sulaimani City in the Kurdistan region, Iraq. So this project is in this area run by me and my partner Kosar, which is not here today, unluckily. As you said, this is my short bio. I'm running such a research team group in here with my partner, Dr. Kosar Hama Aziz. And I'll be talking today, and our work is on the Sulaimani city. So if you look at the my city, it's in the north region in Iraq, which you can see is in the northern area. Okay, so this is the north region. It's actually it's about very cold in winter. Sometimes it goes to -10. I mean, this year it went to -15 degrees Celsius. And in summer is hot, about 40-45 degrees Celsius. It's a mountainous city, my city. And this is the my city at night and in the daytime. You can see it. It's a little bit one of the big city in Iraq, not the most largest one. It's just about, I'm comparing to Cairo, is very, very small. Like it's 1.5 million, my city. It's not comparable with the Cairo, which is about 20 million metropolitan city. So let me talk about the background of research here. And one of the things which we really interested in it is there is no lot of research in this area. So actually there are very limited research on indoor pollution in this area. I would say our area, our city, it's a virgin area for research on the air pollution, indoor air pollution, outdoor air pollution. There are some few, I can say, some few master's work or PhD dissertations on outdoor air pollution, but there are no real systematic scientific indoor studies in the pollution. I would say in the whole region, not just my city. So working on this area, I'm sure it will have more than just, given the indoor pollution profile, and it would be very beneficial even for the decision makers in our region. So we did the research on the air pollution Regarding the outdoor pollution sources, which we have impact on the air pollution, as you know, there are some parameters that affect the pollution, like vehicle pollution, due to the lack of good public transport. One of the problem actually in my city, which is there is no very good public transportation. For example, there is no underground metro, there is no trains working in the city, which this is make all the transportation either by car or by bus. So that affects not just the outdoor pollution, it affects also the indoor pollution as well. And one of the problem actually, I'm sure some of the developing countries have this problem, is there is no I would say the national, we call it national electricity. It means the electricity that comes from the clean sources. So most of the electricity comes from the diesel-based electricity generator. So there's the generator for for each neighborhood, there are many generators, and those generators, they are running by or working on the diesel. And there is a huge amount of the pollutions from these diesel generators. Like for a small neighborhood, you may find 5 generators. For a hotel, each hotel, for example, has own generator. Sometimes each restaurant has own generator. So there is about probably in the whole area of Kurdistan, there are 6,000 generators working. So it's a huge amount of the generators. I mean, this is also above, in parallel to the vehicle pollutions. There are also oil refinery. As you know, that Iraq is one of the countries that it has a lot of oil and exports a huge amount of the oil. So there are a lot of oil refineries close to my city. So this is also one of the sources of the pollution. Regarding the indoor pollution, you know, all of them in winter, most of the houses are depending on the kerosene-based heaters. So, and that's one of the sources of the indoor pollution. And some areas that depend on the still burning of the charcoal. Air conditioners and barbecues, you know, in summer, biomass burning, and also stoves and LPG. There are a lot of stoves that working on using liquefied propane gas, LPG, and you know that very poor ventilation in some houses indoors are one of the sources of the indoor pollution. So if you look at this photo, you see this type of the heaters that you can find in every homes in Iraq. So this is a kerosene-based heaters. So this is the classic fuel, still is in use in not just in Kurdistan, actually in Iraq, for warming houses during the cold season. And 95% of people are still using the kerosene. And this is the source of the emission of carbon dioxide, carbon monoxide, PM2.5 and PM10 as well, hydrocarbons, VOX, volatile organic compound, and even VSC, volatile sulfur compounds sometimes also. So this is one of the problems of the indoor pollution in our area. So you did the measurement, actually. We did this experiment systematically, and you used kerosene-based, and we put the instrument close to the heater, and also we put sometimes far from the source of the kerosene. Okay, so clear increase in number of particles when using kerosene heater. So we saw that there are huge amount of the particles are produced when close to the heater. Like small particle is 1606 particles per cubic centimeter, and large particle was 77 when there was in the close area, close to the heater. When it's far, it was 1246, and for the large particle bigger than 5, it was 45. So So closing windows and also no air exchange causes very high exposure. So, you know, in winter, usually most of the houses actually are closing the windows. And as I said, there is no good ventilation in some areas. So we did some also basic measurement in standard home, like 3 to 5 occupants. People are usually, you know, working during the day from 9 to 2 p.m. So there is clear increase in number of particles when switching kerosene heater. When they are working on the kerosene, so there is a clear increase in the number of the particle, either small or large. When closing window and no air exchange causes very high exposure. So when the windows are closed, you can see there's an increasing of the number of particles. When there's a good ventilation, there's a decreasing of the during this period. So this period, you can see this is when the switched off period, when there is an opening of the window. As well, clear increase in number of particles when switching kerosene heater and windows and door were opened. So those are also this is a good indicator that when the windows are closed and no good ventilation, there's a huge amount or a large amount of number of particles, either small one or the large one. So we did this research also. I'm sure you guys know that we published this paper for the car exposure, in-car exposure. That was of the Care Cities project. Cars are commuting lifelong. You know that the first assessment we did it, and we got these results. I can show you this one here. So if we compare the PM25 concentration, showed relatively lower when compared with other cities. So if you look at this is the Sully area comparing with other cities like probably Dhaka and Sao Paulo, Cairo. You see our area PM25 was relatively low comparing to that cities. So low PM25 concentration might be related to traffic emission, low on-road concentration due to lower number of cars if compared with other cities. So that's one of the reasons. And another reason could be associated to the background PM25 concentrations and probably related also to the type or the quality of the gas that we are using in the cars, the gasoline that we are using. And again, in the same study in car exposure, Sulaimani city showed similar PM25 concentration to some cities at different morning and evening peak time. So during the evening peak time and morning peak time, let's say due to the rush hour, somehow our result in our cities in the in-car exposure, they were comparable. PM25 concentration showed highest during window open due to high on-road level, while during the circulation was the lowest. And this is, I think, is understandable. Like during the circulation, when the windows of the cars are closed, of course, the PM25 was the lowest, or it was lower comparing to the other one. You know that we published this article and also that one as well. So regarding the in-kitchen aerosol exposure, we chose 5 homes from the low-income homes around my city, around my city, and this is the picture of the houses. Usually, we use this kind of the stove. This is the gas stove. We use LPG gas, liquefied propane gas. This is in most of the Iraq they are using LPG. In some areas they are using the kerosene-based stove, but mostly is LPG gas. So the reasons for increasing the number of the in-kitchen exposure for everywhere is the fuel type, the ventilation, and also occupancy with volumes. Of course, small kitchen contributes to high exposure to cooking aerosol, and so on. So this is the we did for 5 houses in my city. I can show you. This is the map for everywhere. So let's go to the results. We assessed exposure in kitchen regarding the particulate matter, employing similar instrumentation that you guys and all of the people used for the 60 low-income homes across 12 cities. One of the interesting thing is this is the first indoor study has been done in my city, and this is what makes us very happy, and we are proud of this project. Actually, this is the first indoor systematic study of the indoor study. So Sulaimani homes showed relatively low PM25 concentration when using dual ventilation. So dual ventilation, as Professor Ahmed said, either mechanical using extraction fan or natural due to opening doors and windows. One of the homes, let's see, we call Sul 5, showed relatively high average PM25 concentration than the other homes. You see, one of them showed very high concentration. This might be related to the kitchen size and time of the cooking, like spending more time in cooking or more cooking per day. This will also contribute to the increase in indoor pollution, or let's say the indoor kitchen. So in this figure, effect of ventilation show the box plot of PM25 concentration in all homes in everywhere. So all 5 homes use dual ventilation, and of course LPG as a cooking source, and it's very common in my area. So PM25 concentration show relatively lower than the other city due to the effect of dual ventilation. So when there's a dual ventilation, so the concentration of the PM25, it was very low comparing to the other cities and comparing to those homes that they didn't use the dual ventilation. Regarding the ratio of the PM25 to PM10, this slide shows the ratio of the PM2.5 to 10 for all homes in all the cities. So regarding my city, all homes showed average PM25 to the PM10 was less than 0.5. You know, this is an indicator for the predominance of the coarse particle. This occurrence could be ascribed to the water-based cooking, such as boiling and stowing. So, yeah, in my area, boiling and stowing is more predominant in the kitchen. Usually, frying, they contribute to more emission of the particulate matter. They do it usually outside the kitchen, not in the kitchen. And this trend of the level of PM25, all homes shows relatively low PM25 trade level. These results support the previous finding for homes in my city. So indoor air pollution mitigation opportunity, this is encourage government to implement using clean and environmental friendly transportation like electric buses, trains, and trams, and encourage people to use public transportation. You know, as I said earlier, like in my area, usually we use, there is not a good public transportation in my area, which means that we are not using like the trains, trams, electric buses. So this is a good indicator for the government to encourage people to do that, to use, to encourage, to improve the public transportation. Using internal gas-based heating system as alternative for kerosene-based heaters. And people are starting actually now to use the internal gas-based heating system like centralized gas system instead of the kerosene-based heaters, which is not favorable everywhere. One more point, which is increasing solar panel to produce electricity instead of diesel-based electricity generator, which increased indoor air pollution due to installing them near residential areas. This is also an opportunity or good suggestion for the people to use solar panels as a renewable and clean sources for the electricity. So our conclusion is preliminary results showed kerosene-based heater one of major source for PM indoor pollution in homes. This is a good, actually that was very good systematic study that we can show to the public here and to the decision maker that here you are, the kerosene is one of the major sources for the pollution, and it could be one of the sources of the producing health impact to the people. And also using of extraction fan reduces the average in kitchen PM 2.5 and PM 10 exposure, as we proved in this manuscript. Diesel electric generator could be another indoor air pollution and should be examined. Also, this is we will do it more in detail later. More IAP studies should be done in different seasons. Plan that we should do it in future using different seasons like winter and summer to understand IAP sources and find effect of kerosene heater and air conditioners on IAP in homes and in Kurdistan region. Of course, we can try to use more number of houses to get a more representative sampling of the research. So let me acknowledge the people and University of Surrey as well, and the first one, Professor Prashant Kumar, for organizing this good and wonderful research, and also Dr. Sarkot Hama. He is in close contact with us, and all GCARE team, and also the University of Sulaimani, which also supports our project always, and KRE Cities and Cairo Home and KTP-IAQ project. And many thanks for all of you for listening, and I'm ready for discussion and answering your questions. Thank you.
Professor Khalid, thank you very, very much for an equally most impressive talk to that of Professor Ahmed as well. That was a tour de force. And what I'm now going to do is hand you back to Professor Prashant, who will field the questions and answers. Thank you very much indeed, gentlemen.
Thank you very much, Professor Susan, for your excellent, the chairing of the sessions. We got 10 minutes left for the question answers. And thank you for both our speakers who did a fantastic job, not to remain in time, but also presenting the key sense and the key problems and the key findings, in their presentations. We got around 10 minutes, so I can see there were a couple of questions already in there. So I would encourage our participants to leave their, the questions in the Q&A chat box if you have any. So I'll start with the first question, which comes from somebody from possibly from Egypt. They ask what Surrey can provide to support the research conducted in Cairo. So before I say something, maybe I would like you to reflect upon Professor El-Gandy, given that we have been working collaboratively. So what kind of the support possibly we provided you in this research?
Yes, Professor Prashant, thank you. Actually, we have collaboration with University of Surrey through Dr. Prashant in many projects. One of them was the CARE cities, and we had a co-supervision on a PhD student in that project. Then we had care homes where we collaborate to investigate the indoor air quality in low-income homes, in kitchens of low-income homes in Cairo. We also had a couple of international workshops that was carried out at the American University in Cairo in collaboration with the University of Surrey, which concerned with the air quality in general, and many experts, international experts, were actually invited into these two workshops.
Thank you very much, Professor El-Gandy. Just to add, actually, these are collaborative projects. So as you might have realized that there is a huge amount of data collected in different cities at a very short time scale with a modest amount of, the funding support. So that basically reflects like a, the collaborative study, which is kind of a do-it-yourself kind of, the approach we have taken, where we designed the study and we had, the co-create actually the implementation plan, so that the partners who have even not had actually the experience of running this kind of studies before, they can run it by themselves. So it's not just extracting the data, but it's more of capacity building, but also learning from the experiences, understanding the challenges in different domains. So yeah, it's been a fascinating journey since we started with the, the clean air engineering kind of initiative a few years back. The second question is from Maria di Fatima Andrade from University of Sao Paulo. So she's another collaborator in the consortium, and she asked from Professor Omer that thank you for bringing all these new information. Do you know if there is any initiative in imposing regulations in the emissions of the diesel fuels in cars and generators?
Okay, so regulation, regarding my, home country?
Yeah, so for example, in Kurdistan, are there any regulations which regulate the quality of the fuels for the diesel cars and generators?
Right. Yes, yeah, there's the regulations, like usually they focus on the low content of the sulfur in the diesel and the gasoline as well, and the type of the lower amount of the naphtha and the heavy component of the hydrocarbons in the gasoline and even diesel. Yeah, there's a huge regulations for that, but the problem is because the sources of the electricity is limited, like from the hydropower, there is not a huge amount of electricity coming from the hydropowers. So that's why the country are depending on the dependence on the electric diesel generators. So there is not a good alternative. We hope in future the renewable energy will be a good alternative for the diesel-based generators.
Yeah. So,
but if you use even the cleanest quality of the diesel, still you are in front of a lot of the pollution, right?
Yeah. So just to ask, I think a little bit more about that. So what kind of regulations are followed? For example, in Europe, so there are Euro standards for the diesel emissions. For different countries, either they have their own specific regulations or they adopt actually the US EPA kind of, the regulations. So I'm just wondering, in Kurdistan or in Iraq in general, are they having their own regulations or they are adopted from?
In some part, we have own regulation, which mostly close to the American standard one.
Okay.
Yeah, exactly. It's a pretty much close to the American standard, IST, something like that. Yeah.
Mm-hmm. Okay. Yeah, fantastic. I don't seem to have any other questions here. But maybe I can ask a question each from both of you.
Yeah.
We still got the 4 minutes left in there. Professor El-Gandy, I was just wondering, when it comes to the household air pollution, so we know that the kitchens are kind of a big area where the people are getting exposed, especially the women actually who are involved in cooking. I understand from the Cairo perspective that there is quite a lot of infiltration of the natural gas. But if you go a little bit more in suburb areas, what kind of fuel is used actually, especially for the poor communities?
Okay, it's mainly natural gas as well, but like it's sold in as gas cylinders. Okay. So in urban areas, it's more into a network of pipes. But in rural areas, they are use also natural gas mainly, but it's sold in cylinders. And maybe some farmers or some people in the fields will use solid fuel, but just to maybe boil something or it on a limited basis. It's not
like the biomass.
Yes.
I mean the wood and the.
Yeah.
Okay.
Or wood or something like that, just to for little use. It's not a common use actually.
Yeah. Okay. If I repeat the same question to you, Professor Omer, so I know understand from the Kurdistan perspective, but if let's say you go further in the down, the rural areas,
very remote areas.
Remote areas, yeah. So what kind of
exactly? Yeah, in the still same in the rural areas, they're using the LPG, liquefied propane gas, in the cylinders, and those cylinders they sell it everywhere, even for the remote villages as well. And of course, in the remote villages, they use the wood, biomass, and I think kerosene as well. Yeah, in the more rural area, the more chance for using biomass and for like using wood, dead wood, of course. Yeah.
Okay, that's brilliant. Yeah, so I think we just got a minute left. So I would like to wrap this session here. I'd like to thank again to start with our guest today, Professor Susan Lehman-New, for your time and opening this webinar, and our two speakers, Professor Ahmed El-Gandy from Egypt and Professor Khalid Omer from Kurdistan, Iraq. So we can give a big round of applause to everyone for their fantastic contributions today. We got our next and the last webinar of this series, which is on 24th of March, which is 9 to 10 a.m. UK time. I will be presenting the overview of the care homes and giving a little bit more in terms of what we found actually in the cities and what kind of recommendations we can take forward from these studies to bring a difference to the current situation of the exposure. And then we got a colleague from Trinity College Dublin, Professor Onges McNabola, so who has been part of this the consortium on the periphery as well. So he'll be presenting some of the work on the passive indoor air pollution control in ventilation systems. So thank you again, everyone, for attending this webinar, and thanks to all of those team members from the GCARE who have been really working hard to get these workshops, the webinars running, and our event team who has been organizing them so well. So thank you very much, everyone, and we'll see you on 25th of March.
Goodbye.
Thank you.